90% of claim denials are preventable. Of those, around 24% of healthcare denials are due to errors during front-end revenue cycle processes. That's a lot of money healthcare organizations are leaving on the table. But what should you do to prevent claim denials on the front end of your revenue cycle? Here are 9 easy ways to prevent front-end healthcare denials. Number 1. Educate your staff. No matter what organizations tell you about their automated insurance eligibility or verification tools, denial prevention starts with your staff. Front-end staff is often unaware of these expenses associated with front-end denials, as the majority of their time is attributed to streamlining the waiting room. But nothing can replace a knowledgeable staff and a solid pre-visit process. Your staff needs to be able to navigate the nuances involved with customer service, as well as know how to interpret different policies and discuss patients' coverage issues. Number 2. Establish a front-end and billing partnership. The relationship between your front-end office and your billing team should be treated as a partnership. Although the majority of denials can be attributed to the front-end office, the billing office needs to identify missteps and inform the front office. Number 3. Establish consistent checks on demographic information. During scheduling, establish a follow-up process 2 or 3 days prior to a patient visit to verify insurance and collect demographic information. Then review those details again at the time when they walk into the door for their visit to ensure that their phone number, address, and other patient identifying information hasn't changed. Number 4. Patient scheduling. Ask the patient questions regarding the details of their visit during the registration phase so you can better schedule the type of appointment and length of the visit. As an additional step, check on prior visits a patient has had to make sure it's covered at the time of service and to verify coverage through eligibility. Number 5. Implement price transparency. Research and look for tools that are often available through insurers that provide an estimate of the cost of upcoming service or procedures. These tools, such as eligibility verification, base their costs on a patient's benefits and historical claim data. Price transparency can educate patients about what their financial responsibility is so that there are fewer surprises when it comes time for billing. Number 6. Time management. When a claim is denied, you usually have a 90-day window to rework and resubmit it. Delays in resubmission usually occur due to processes involved with reworking front-end denials because you have to spend time researching the mistake, updating the claim, and resubmitting it. If you do not have proper time management processes put in place, then you can run the risk of not getting paid. Number 7. Establish a daily claim submission schedule. Keeping up with claims and submitting new ones each day is a best practice to ensure AR days are accurate and will allow the appropriate amount of time to identify any mistakes that may be occurring prior to claim submission. Number 8. Implement a 24-hour edit window. Inability to identify coding or charge entry errors prior to claim submission results in claims being rejected by the payer. This means that you need to establish a streamlined internal process to work through edits and correct claims within a 24-hour time frame before submitting to your clearinghouse. Number 9. Utilize claim scrubbing and edits. Revenue cycle solution organizations like eTactics have created solutions that apply appropriate edits to your claims, including National Coverage Decisions or NCD, Local Coverage Decisions LCD, and Correct Coding Initiative CCI. Additionally, these solutions will allow you to request custom edits, which can filter and highlight mistakes, then place affected claims into a work queue for correction. For more information on how to streamline and prevent front-end denials, visit www.etacticsinc.com and subscribe to our YouTube channel for updates.